Good morning everyone. I am Amrita, Associate Professor, Indira Ganesan College of Nursing. Today we are going to deal about an important and interesting topic in obstetrics and gynecological nursing, that is labor and its stages. So, what is labor? Series of events that takes place in a genital organ in an effort to expel the viable product of conception out of the womb through the vagina into the outer world is called labor. In simple words, some events that takes place in the genital organ for what? For delivering the baby or for expulsion of the baby. From where? From the uterus. So, how means through the vagina. So, from the uterus the baby has to deliver out through the vagina is called a labor. Okay. So, next we are going to deal about stages of labor. There are 4 main stages in labor: first, second, third and fourth stage. So, first stage means starts from true labor contraction to full cervical dilatation of the cervix, and second stage is from full cervical dilatation till infant birth. Third stage is from infant birth to placental delivery, and fourth stage is observation of mother, baby and the status of uterus. So, these are the 4 main stages of labor. Let me discuss about the stages in detail. Okay. So, first is first stage. It is also known as cervical stage of labor. So, first stage is also derived as cervical stage, and it starts from the onset of true labor pain and ends with full dilatation of cervix. So, what is true labor pain? Means it has certain characteristics. So, the first characteristic is the painful uterine contraction, that is a term mother may experience severe pain with severe uterine contraction, and that pain may not relieve even if you are administering any sedatives or enema. That is the first characteristic of true labor pain. And the second thing is it is associated with show. What is show means? See, in the first picture you may see that yellowish color discoloration, that is called mucus plug. So, from the vagina the mother may expel out the mucus plug, and this mucus plug is mixed with blood, that is called show. This is the second characteristic of true labor pain. And the third thing is progressive effacement and dilatation of cervix with descent of the presenting part. Presenting part is nothing but the fetal head. Okay. So, through continuous descent the fetal head that touches the vaginal muscle, that is pelvic floor muscle. So, with the effacement is nothing but thinning of the cervix. Okay. See, in the first picture you may notice that the cervix is not effaced and not dilated, but in the second picture you may notice that cervix is fully effaced. Effaced is thinning of the cervical wall, and the os is open. Opening up of the cervical os is called dilatation. Okay, that is 1 centimeter dilated, and in third picture you may notice that the cervix is fully effaced and fully dilated to 10 centimeter. If the cervix got fully dilated, then only the baby got delivered out through the vagina. So, this is the third main characteristics of true labor pain. And the fourth thing is formation of bag of membrane. So, this bag of membrane will form in the first stage, and at the end of this first stage this bag of membrane got ruptured, and this helps for delivering of the baby. Okay. So, these are the 4 main characteristics of true labor pain. So, what are they? The first thing is painful uterine contraction at regular interval, and the painful uterine contraction, that pain will not subside even if you are administering any sedatives. And second thing is the mother may expel out the show from the vagina. Through the vagina the mother may expel out the show. And third characteristics is progressive effacement and dilatation of the cervix, and the fourth thing is formation of bag of membrane. And phases of first stage of labor. So, there are 3 main phases in the first stage of labor. First thing is latent phase, active phase and transitional phase. Okay. So, latent phase is mild contraction. So, the mother may experience mild pain. Because of this mild uterine contraction, the mother may experience mild pain at regular interval, and this pain may last for 20 to 40 seconds up to 3 centimeter of cervical dilatation. It takes around 6 hours for primigravida mothers. What is primigravida means? Gravida in the sense pregnancy. Okay, primi means first. So, first time pregnant mother will have 6 hours for latent phase, and multipara, para means number of delivery. So, if the mother may have multiple delivery, in the sense the mother may have 4.5 hours in the latent phase. And next one is active phase. During the active phase, the mother may experience stronger uterine contraction and the pain may last for 40 to 60 seconds. Okay. So, here in this stage, in this phase, the cervical dilation will be 7 centimeter, will be up to 7 centimeter, and for primigravida mother the duration of this active phase is 3 hours, and multipara mothers the duration is 2 hours. And third thing is transitional phase. The mother may experience strong, very stronger pain, that is the pain may go for peak level. So, here 2 to 3 minutes the pain interval is 2 to 3 minutes, and the duration is 60 to 90 seconds. So, the pain may last for 60 to 90 seconds. Here only the cervix got fully dilated, that is 10 centimeter. Once the cervix got this much of dilatation, then it helps the baby, that is fetal head, to travel through the vagina. Okay. And for primigravida mothers it lasts for 3 hours, and for multipara it lasts for 1.5 to 2 hours. So, this is the first stage of labor. What are all the nursing implications during this first stage? So, see in this picture, the cervix got relaxes and it got dilate and thinning out. So, the major event that takes place in the first stage of labor is thinning of the cervix, that is effacement, and dilatation of the cervix, that is 10 centimeter of dilatation. This is the first stage. In short, this is the first stage of labor. And what are all the nursing implications? As a nurse, what you are going to do is, during the second stage you have to provide proper comfortable position to the mother, that is whether you may advise the mother to walk for a while, and advise to lie in a supine position, and advise for a sitting for a while, and rest in a left lateral position. Okay. And next one is, you have to assess periodically. What you are going to assess is, first one is frequency and strength of uterine contraction. You may note the frequency, that is interval and duration of the uterine contraction, and you also note the cervical changes, that is expulsion of show, that may persist or not, that you have to assess, and fetal station and position, that is station of the fetus and the position of the fetus you have to assess through the vaginal, per vaginal examination. And the last thing is, you have to assess the fetal heart rate, that is baby heart rate. For every 15 minutes you have to assess during this first stage of labor. And the average duration, as I told, primigravida is first time delivery. Okay, the mother will go for first time delivery. So, the mother duration of first stage is 12 hours, and for multipara the duration is around 6 hours. Okay. Next we will move on to the second stage. Okay. It starts from the full dilatation of the cervix. Full dilatation of the cervix is 10 centimeter. Now, the cervix got dilated to 10 centimeter and ends with the expulsion of the fetus. The second stage is nothing but delivery of the baby. When the baby got delivered is second stage of labor through the birth canal. Birth canal is nothing but through the vagina. Okay. And it has two phases. One is propulsive phase and second thing is expulsive phase. Okay. What does propulsive phase means? It starts from full dilatation to the descent of the presenting part to the pelvic floor. Assume this as a fetal head, okay, baby head, and this as a vaginal muscle or pelvic floor muscle. Okay. So, through continuous descent, the fetal head got come down, and once it touches the pelvic floor muscle, so that till that it is called a propulsive phase. And next thing is expulsive phase. What does expulsive phase means? Apart from the stronger uterine contraction, the mother push the baby, want to push the baby. That pushing down is called bearing down effort. During the second stage, the doctor and nurses advise the mother for strong pushing down effort. Apart from strong uterine contraction, the mother need to push the baby out through the vagina. So, and that pushing down effort and the delivery of the baby is called the expulsive phase. Expulsion is nothing but delivering out of the baby. So, these two things comes under the second stage of labor. Average duration of second stage of labor is for primigravida mother it takes around 2 hours and for multipara it takes around 13 minutes. Okay. So, here see the picture, apart from uterine contraction the mother need to push out the baby through the vagina. So, only the baby head got delivered out and then the trunk. So, this will happen in the second stage of labor. Okay. So, nursing implication. So, what are all the things as a nurse you have to do is, first you have to instruct the patient for quality pushing. So, as I told earlier, apart from uterine contraction you need to push the baby, that is bear down the baby. So, that is the patient quality pushing, and also you have to provide a clean and quiet environment, and during pushing you have to give positive feedback, that is around nurses and doctors you have to give positive feedback for the mother to push out the baby. And take a note, after delivering the baby you have to give proper newborn care. Once the baby head got delivered you have to give suctioning. Suctioning is nothing but you have to suction the baby from the nose and the mouth. Okay. And third stage, next is third stage, it begins with expulsion of the fetus and ends with expulsion of the placenta. That is, now the baby got delivered in the second stage, and third stage delivery of the placenta. Placenta delivery is called the third stage. Its average duration is around 15 minutes both for primary mother and multi mother. Okay. So, this is the third stage. So, here as a nurse you have to first give the oxytocin for controlling the bleeding, and you have to wait for the placental delivery, and till the placenta got separated you have to wait for the placental separation, and then only the you have to deliver the placenta out. So, okay, this is the third stage. And fourth stage is nothing but it is the observational stage. You have to observe the mother, fetus, that is infant, and the status of the uterus, that is bleeding and all you have to observe, and also the placental examination, you have to done the placental examination. So, these are the 4 stages of labor. So, I am going to conclude now. So, the duration of labor for primigravida mother, that is in addition of first stage, second stage and third stage, the primigravida mother duration is around 13 to 15 hours for delivering a baby, and for multiple mothers the duration is around 6 to 8 hours. Thank you, students.